Why is free T4 important for levothyroxine therapy? Imagine trying to tune a musical instrument without knowing if the strings are in tune. That's similar to managing hypothyroidism without measuring free T4. When patients take levothyroxine, a synthetic form of the thyroid hormone T4, the goal is to restore the right balance of hormones in the body. But how do doctors know if the dose is just right? That's where free T4 becomes essential. Free T4, or free thyroxine, is the portion of the hormone that is not attached to proteins in the blood. Only this unbound part can enter cells and be converted into the active hormone T3. Since T3 is responsible for regulating metabolism and energy, measuring free T4 gives a clear picture of how much active hormone is available to the tissues. It's more accurate than total T4, which includes both bound and unbound hormone, because most of the T4 in the blood is bound to proteins and inactive. Levothyroxine is a prohormone, meaning it's a precursor that the body converts into T3. If the free T4 level is too low, it indicates that there isn't enough hormone circulating to meet the body's needs. Conversely, if free T4 is too high, it can cause symptoms of overmedication like rapid heartbeat, anxiety, or bone loss. That's why monitoring free T4 helps doctors adjust the dose precisely. While TSH, or thyroid-stimulating hormone, is often used to guide therapy, it can sometimes be misleading. TSH levels may lag behind changes in hormone levels or be affected by other factors like pituitary function. Measuring free T4 provides a more immediate and direct assessment of hormone availability, especially in cases where the pituitary gland may not respond normally. In some patients, especially those who do not convert T4 to T3 efficiently, free T4 levels might be normal or high, but symptoms persist. About 10 to 15% of people on levothyroxine may have low T3 levels despite normal free T4, which can influence how they feel. Monitoring free T4 helps identify these cases and may lead to considerations of alternative therapies, although this approach is still under discussion among experts. When adjusting levothyroxine doses, doctors typically check free T4 levels after 4 to 8 weeks to see if the hormone levels are within the target range. In stable patients, annual checks are common. Proper monitoring ensures that patients avoid the risks of undertreatment, like fatigue and weight gain, or overtreatment, which can cause heart problems or osteoporosis. In summary, free T4 is a key marker in levothyroxine therapy because it directly shows how much active hormone is available to the body. It works alongside TSH to give a complete picture of thyroid function, guiding safe and effective treatment. Every person's metabolism and hormone conversion are unique, so regular monitoring of free T4 helps tailor therapy to individual needs. Always consult a healthcare professional for personalized advice, but understanding the importance of free T4 helps clarify how thyroid treatment works to keep you feeling your best.